Example of the brutality of this group and why the president has articulated and is moving out in a comprehensive way to degrade and destroy ISIL. Let me now turn to my colleagues on the latter part of your question.
With regard to the efforts that the CDC is pursuing and that we've been pursuing, as I mentioned, we've had the efforts in Charlotte. We saw the system work. We saw it work in Mount Sinai. We have a case here. Actually, I think everyone knows, Howard and the question there. And so the systems are in place. We continue to communicate. We continue to give good instruction. I think it is important to reflect on whatever lessons we learn, we build and incorporate. As I said, we'd issued a seventh one of these health alert network notices to make sure that if there are any lessons learned as we go forward, we will continue to incorporate those.
Can I follow on that, please? What the lesson learned from some of these failures in Dallas was, and how you may be changing or modifying any lessons from
what we know are the critical steps that we have said throughout the process, and that is about identification, and identification at the point at which there actually is a temperature, and as Dr. Fauci said, when something can be done. What we are doing is making sure that hospitals, health workers across the country know that when they see that, what steps to take, how to isolate, and what to do immediately when they see those steps. And we'll continue to do that and make sure that we are responding to the questions that we're getting from the community.
Secretary, what about the case, potential case at Howard University? Is there any new information about that? And to Dr. Fauci, if it doesn't spread like the flu or a cold, why is it spreading so quickly, and are you confident that we won't see an outbreak in the U.S.?
With regard to the Nigeria case, haven't seen the results of the test yet, and I think that's the most definitive thing and the most important thing. And what you see is people taking precautions because the symptoms are malarial, but they could be this. And so I think everyone is taking the appropriate steps, and it gets to the earlier question. We believe that's the right thing to do. CDC gets contacted. We make a determination and work with the community and the health center in this case to do the test. When we get that definitive, as you know, in each of the cases, we make public as quickly as possible what we know about that. And
There's also a patient being tested at Shady Grove Adventist, I'm led to believe. Are you being informed of all of these suspected cases?
Do you want to answer the one question?
Yeah, let me answer the question here first. So you were saying if it's only transmitted a certain way,
It doesn't spread as fast as the
right?
cold.
Why is there such an outbreak? If one goes to Liberia or Sierra Leone or Guinea, you will see the conditions that make it very, very clear that coming into contact with bodily fluids, the most efficient way of transmission is unfortunately the very thing that holds families together. Someone gets sick, they take care of them, they touch them. If they're not aware of the fact that you can't come into personal contact without having the proper protective equipment. Funerals are another way, as well as preparing the bodies and the customs, the long-range traditions that have gone with the funeral. So the mechanism of transmission, which we've all said, direct contact with bodily fluids, amply explains what is going on right now in the West African countries.
And you're convinced no significant outbreak in the U.S.?
Yeah, the reason I say that, as I said, let me just very briefly reiterate it. The reason there is an outbreak now is because the healthcare infrastructure and system in those countries is inadequate and incapable of actually handling the kind of identification, isolation, rapid treatment, protection of the people who are coming into contact, and contact tracing. That's something that we have very, very well established here. So we have a case now, and it is entirely conceivable there may be another case. But the reason that we feel confident is that our structure, our ability to do those things, would preclude an outbreak.
Excuse me, sir. Dr. Fauci, or Ms. Monaco?
Let me just take this gentleman's question here, the question of are we being notified of cases? And this goes, I think, directly to what Dr. Fauci just said. We have a system, we have an infrastructure that is in place. We have a public health alert system through which CDC has distributed information from and established a laboratory network for testing. So when there are potential symptomatic individuals who present themselves in medical facilities. Those precautions that are immediately taken. Those tests are undertaken through a network of laboratories that CDC has validated and has provided clear guidance to. So we have the structure in place when we identify potential cases to resolve those. And if there are actually confirmed Ebola cases, as we have seen one of in Texas, we take the immediate steps, isolate them, provide the treatment, undertake the contact tracing, and our infrastructure works to make sure we are aware of those cases and take those steps.
So when Secretary Burwell said we had a case at Howard, but did not say we had another, a potential case, I'm sorry, did not say we had another potential case at Shady Grove Adventist, and the hospital has already put out a release, are there only two? Are there more than those two? In the Washington area?
Right now,
Right now.
you've indicated and you've talked about the potential case at Howard. We'll see the resolution of that, as Secretary Burwell discussed.
And the potential case at Shady Grove Adventist.
Those reports, as they come in, they will be addressed. Those tests will be undertaken. The public health infrastructure is reacting and is taking the steps necessary to isolate that individual. I think perhaps Dr. Fauci will want to address this, or Secretary Burwell, but every hospital in this country has the capability to isolate a patient, take the measures, put them in place to ensure that any suspected case is immediately isolated and the follow-up steps that have been mentioned are immediately taken.
Lisa, so to what degree have you debated internally, and are you ever going to be prepared to recommend to the President what some have suggested publicly today, a travel ban for these 3 countries for any passengers who may seek to come to the United States either directly or indirectly? In general, if you could tell us, how do you think your deployed assets are as far as catching up with what you intend to do? And do you think it's time at some point to have military medical people actually involved in the direct care as opposed to setting up the infrastructure in which care will be taken out?
I'll take the travel ban question first. I know that has been something, an issue that has been raised. I take note of Dr. Frieden's comments in this regard, which is to say that, in fact, right now we believe those types of steps actually impede the response. They impede and slow down the ability of the United States and other international partners to actually get expertise and capabilities and equipment into the affected areas. And as we've said and stressed from this podium and others, the most important and effective thing we can do is to control the epidemic at its source. So what we want to be able to do is ensure we're getting the assistance, we're getting the expertise, and we're getting the providers into the affected region and not impeding that.
But I mean, Lisa, before you go, many Americans might say, well, half a ban, not getting there, but exiting. Are you considering that active?
Well, let me just respond to that. As I mentioned, as the measures are being taken to screen individuals who are departing from the affected countries, and we've spoken to that, CDC professionals actually have provided the assistance and the training and the advice to airport officials in Liberia, Guinea, and Sierra Leone. And as a result of those measures and those screening steps that have been undertaken, many people, dozens of people, have actually been stopped from traveling. So we see those issues, those steps actually being effective. General?
Yes, sir. Sir, for us, the speed with which we're moving out is really focused on the Ebola treatment units to get them built. That will take us several weeks. We're working with the Armed Forces of Liberia. We're working with contractors, and we're working with a logistics chain of events to get the bill of materials there as fast as we can. It'll take us several weeks to do that. And we will get the, we are also doing some of the ones in some fairly isolated areas that are hard to support and get the equipment out there. So those will take us the longest. On the other one, sir, right now we are not anticipating that military personnel will be treating the people, and again, that will be a decision made in the future if that ever gets to that point. But the international community has said not right now, that's not what we need.
You do have lots of folks capable of doing that, don't you?
Yes, we do. We also, right now, as you say, medical professionals, there are 3 labs that are operating out there that are done by military medical professionals right now, and that's doing a great job identifying who has the disease and who doesn't, which is focusing who they're able to treat the patients. Okay, thank you.
Have you considered a waiting period between
Mike.
issuing a visa and travel?
As Josh would say, I think we're going to move around a little bit.
So help me understand the stuff that you've talked about in terms of preparedness here in this country, the conversations with the hospitals, the coordination with the local authorities and all, seems very dissonant, I think, to people in the country who look at basically the first case, or one of the first cases, and see that the whole thing broke down. At every step of the way, there were breakdowns. It broke down, as the person back there was saying, when he lied on the form. It broke down when the hospital turned him away. It broke down when the materials that were in his apartment haven't been thrown away. It broke down, I mean, it feels like to Americans, like you guys are up here talking about, we have this great and perfect system that's going to be able to, you know, contain this virus because we've done all this preparation, and yet it doesn't look like it's working. And so how should the average person have confidence that whether it's the case in Howard or whether it's some case somewhere else in the country at the moment, that somebody isn't being turned away there, that somebody didn't get, you know, their temperature got taken in Africa but didn't get caught, and so they're on a plane as we speak? I mean, square the dissonance between your confidence and the fact that things don't seem to be working.
Let me respond to that and ask my colleagues if they want to add. I think the American people should be confident for all the reasons that we have stated and the President has spoken to, and that is because the public health infrastructure we have here is so expert, is so extensive, and is considerable. And as Dr. Fauci has discussed and Dr. Shah has mentioned, the situation in Liberia, Sierra Leone, and Guinea could not be more opposite in terms of the public health infrastructure and the ability of officials there to immediately isolate an individual case. What you're seeing in Texas is the isolation of that patient, the contact tracing that is being done meticulously by CDC and local health professionals. The other thing I would say to your question is, it is true, we have a case in Texas. The Howard case that has been mentioned is a potential case, and I will defer to the medical professionals at Howard to give the definitive view on that. But I think it's very important to remember, this outbreak began in March of this year. And since that time, and since the screening measures that we've discussed from this podium began over the summer, there have been tens of thousands of individuals who have come to this country from the affected region. And we have now seen one case, and as Dr. Fauci mentioned, it is entirely possible we will see another case. However, I would point you and others to the fact that we have now seen tens of thousands of people in the time since March to the current day, and we now have this isolated case in Texas. But we have a public health infrastructure and medical professionals throughout this country who are capable of dealing with cases if they present themselves. And as Dr. Frieden has said, we are very confident that we can stop this and other cases in its tracks. Let me ask my colleagues if they want.
Can you explain within that public health infrastructure what the lines of authority are? Once you have a confirmed case, for example, in Dallas, does the CDC, does the NIH, is there a federal authority? Is it up to the local health department? Who's in charge at that point?
With regard to one of the things, when any test is done, it is reported to CDC. So we have a network, and we want the tests to be able to go quickly. So part of the preparedness that we did was we created capability all around the country for the tests to occur so that they could occur quickly. We want that to happen so that they're not all just coming to CDC. However, when that test occurs, CDC is alerted to the test occurring and the results of the test. With regard to who controls the patient, I think is the question. That is done at the local local level, and we support in that. And the 10 people were on the ground from CDC immediately, I think you all know, in terms of supporting the local health departments in doing the contact tracing and any other issues that they have, whether they're issues of the testing, whether they're issues of the contact tracing. We stand ready to do that. And so while the local health officials, because this is a local issue and that's really a big part of how you're going to do the contact tracing, and they make the decisions on the ground. We are there hand in hand in support, had 10 people on the ground, and work hand in glove with them.
So I want to follow up on that. On the contact tracing, because some people in Dallas are concerned about the contact group being isolated in a highly congested apartment area, and I think that some of them, there's an expression that they should be moved. Is that a protocol that could be repeated in other communities, that the contact tracing group, if they're isolated for some period of time, that's the best place to keep them in an environment where it may be a high-density apartment?
That gets to the earlier question with regard to how local officials are handling their situations specifically. I think Dr. Fauci has gone over the way and the protocol. When you have not had a high-risk exposure, what needs to happen is basic temperature taking 2 times a day on a regular basis. High-risk exposure creates different needs. How local officials choose to implement that, we work in conjunction, we have given the guidance out in terms of what we do, but those are decisions made at the local level.
I have 2 other quick questions. One is, can you update us?
I have to do the Josh
quickly,
move around thing. I think is the rule of the rule.
Can you update?
When Dr. Fauci comes back up, he'll do that.
All right,
We'll take this question.
Mine is also a very quick follow-up. Is nobody concerned that there were these breakdowns in Dallas? And are you really confident that there's not going to be similar breakdowns elsewhere along the same line?
I think when I spoke to the fact that we continue to work on our education and continue to work with locals and put out more and more information, we put out more information and updated information. Whenever there is anything that we see that we could do a better job on communicating, we will do that. And so this is, as I think the General mentioned too, we are going to learn every time and every step, but I think what we're confident about is these processes work. If you look what happened in Nigeria, in terms of the cases in Nigeria, what happened is we quickly activated, and CDC was a part of supporting the country of Nigeria, both at the state and federal level, to put in place the things that it needed to put in place. We know it's about detect, isolation, treat the patient, do the contact tracing. Those are the steps, and now we see where we are in Nigeria in terms of the cases and them having moved through. And this, I think, Dr. Fauci mentioned. And so we believe that as we take these steps, these key core fundamental steps, and we are in the middle of that in Dallas in terms of the contact tracing and making sure that the people that should be, taking the temperatures are doing that. And so that's how we, and why we believe that this is going to work. Should we get, let me go to Dr. Fauci with the vaccine question.
Okay, I'll answer the vaccine question in a second, but I just wanted to make the point that you were making. There were things that did not go the way they should have in Dallas, but there are a lot of things that went right and are going right. If you look at them, the person is now in isolation, being properly taken care of, and the fundamental core basis of preventing an outbreak, contact tracing, is now going on. And that's the important thing, and that's going on very efficiently. The CDC sets down very clear guideline protocols about how to do that, and that's being done. So although certainly it was rocky to the perception of people in reality, but the fact is, the reason I said there wouldn't be an outbreak is because what's going on right now. So even though there were missteps there were good things that happened also. So,
time for one last question.
Yeah, with regard to the vaccine, I don't know who asked the question of the vaccine. Well, obviously, we would hope that vaccine could be a part of the response, even though public health infection control is still the core of getting this under control. Vaccine historically is important. So we have a vaccine, a couple of candidates. The one that's most advanced is the one that we announced just a while ago. The first person in a phase 1 trial received a vaccine on September the 2nd at the NIH in Bethesda. That's the first phase of a multi-phase trial to develop a vaccine. It's called phase 1 because its primary endpoint is safety. If we determine that it's safe, and it looks good so far, and also that it induces a response that you would predict would be protective, which we'll know probably by the end of November, the beginning of December. When you get through that phase, then the next phase is a phase 2, which is many, many more people conducted in the environment where you could prove its efficacy, and that would be West Africa. So the next phase, sometime likely in the first quarter of 2015, we'll begin a trial to determine overall long-range safety and, importantly, whether it works or not.
Lisa?
Yeah, one last question.
Dr. Fauci, for you, if I could. I understand that the purpose of this briefing is to reassure the American public, and you've done that, and probably justifiably so. But as a medical professional, as a doctor, what concerns you most about this outbreak and this particular disease now that it's in the United States?
Now that it's in the United States, the concern is that I don't ever like to see people get sick and people suffer and die. But as a medical professional who has witnessed and experienced the whole 38 years since 1976, I never say I'm not concerned, because that's interpreted as taking something lightly. I take nothing lightly. But I'm convinced by what we have all said today that the system that's in place with our healthcare infrastructure would make it extraordinarily unlikely that we would have an outbreak. And the reason we know that is that if you look at the situations, and Nigeria, as the Secretary mentioned, is a classic example of that. The reason we're having this devastating, painful, very difficult situation in the West African countries is because they don't have the system to be able to contain it. If they had the system, we would not be seeing all of this suffering and dying in West Africa.
Just to follow up, if that's the case, and if it's one case in the United States now, as we know it is,
right,
why are we having news conferences like this, and why are we all so afraid?
Well,
if there's no chance of an outbreak, what is it about this disease that frightens you and us?
Okay, so we're having the press conference because we need to get information out because there is a lot of fear. And the reason there's a lot of fear is that there are many things when you have outbreaks. It's the unknown, it's the cataclysmic nature of it. Namely, it's acute, it kills in a high percentage, and it kills quickly. That in and of itself, almost intuitively, makes people frightened. The other thing that makes people frightened, can this happen to me without my even knowing it, without my having any behavioral change at all? And that's the kind of thing that we have to keep over and over again emphasizing. We respect your concern, we understand your concern, but the evidence base tells us that that is not going to happen. And we have to say that a lot. We have to say it today, and I'll have to say it tonight on TV, and Tom Frieden will say it tomorrow on TV, and we'll try as best as we can to continue to get the message out.
One follow-up. Who bears ultimate responsibility for what did happen, the breakdown that happened in Texas? Is it the hospital? Is it the CDC that didn't send out clear enough guidelines in the beginning? And you say you're taking steps to make sure it doesn't happen again. Is it sending out clearer guidelines, being more communicative? What specifically is being done?
I think it's as with most things, it is about making sure, and I think Dr. Fauci just in his response to the question, we cannot over-communicate about this issue. And we cannot over-communicate in two ways. One, because of the question that was posed with regard to how people feel. And then the second is, this is an execution game in terms of both what's happening on the ground, and that's why it is so important to have the United States military, because there is no one that can help with execution. It is the same in the United States. So the steps that we have to take are about making sure execution, 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 and that gets to your question, which is, that is why we need to communicate and communicate again and communicate with clarity. And if there was anything that people, that's why there are 100 different documents that have been put up on the CDC website, because we put up the document, we get the call if there's a question, and for some reason people don't feel it's clear or have an additional question, we get it up, we answer their question, but we're trying to disseminate that information more broadly. And so what we want to do is, because this is about communication and execution, is continue to do that and do it as much and as quickly as we can. Thank you.
Thank you. The General, question for the General. Thank you.
Live coverage on News Channel 8 as we cover breaking news from a White House press briefing. Various officials trying to calm public fears in the U.S. of the Ebola epidemic. An epidemic is the term they used. Sheila Burwell, head of Health and Human Services, Dr. Tony Fauci from NIH, and other officials explain that the Ebola outbreak is being contained in the U.S. They explain that's because of the existing healthcare infrastructure in this country as compared to nations in West Africa.